Hi, Mrs. Bell. My name is Melissa. I'm going to be your student nurse today. We need to do a dressing change on your central line there. It's been 7 days since the last time it was changed. We're also going to draw some blood and do a cat change at the same time. Can you first start off by telling me your full name and your birth date, please?
Tinker Bell, May 20th of 1983.
Perfect. And do you understand what we're doing today?
I think so. I've been doing this for quite a while.
Have you? Good.
Yes.
Good. And what is it that we're going to be doing?
Well, I think you told me earlier this morning that we're going to be drawing some blood out of, this thing on my chest. And you said you were going to change the cap or something?
Mm-hmm.
And you said something about flushing it and changing the bandage around there.
That's right. We're going to change the bandage because it's been a week since you've had it done. And draw some blood and all that fun jazz. You got it right there.
I'm excited.
Good. I'm glad. I am too. So I'm going to start off by getting ready to take the old dressing off. Just need to get some stuff on here.
That sure is a colorful outfit.
Right? Very beautiful, isn't it? Just a glove. All right. So, all my supplies over here eventually. So we're also, fogging up my glasses here. As we're doing your dressing change, we're going to kind of take a peek at everything and make sure that there's no redness or signs of infection, anything like that going on as well.
Okay, that sounds like a good idea.
I'm pulling towards your insertion site so that I don't end up pulling that line any farther out. Checking your dressing, make sure there's no gunky stuff on there.
It looks okay?
It looks okay so far.
Oh, good.
So this next part of the procedure is sterile. So I've put a mask on you so that you don't breathe down on the insertion site. If you can kind of turn your head, keep it away. That way we don't breathe any germs right down on that. There we go. Get my sterile gloves on here. All right. Well, got my fingers in the right hole, and that'll be better. All right, so got my gloves on. I'm gonna make sure you keep your head turned, okay?
Okay.
Don't need that. Don't need that. Or that. All right, so this is some chlorhexidine, I'm going to touch you with this hand. This hand's not sterile no more. I'm going to clean everything around your insertion site. Pop that, and we're just going to scrub. Sounds nice and squeaky clean.
It sure does.
Making sure to clean your line as well. There we go.
Is there any blood on that?
No, there's not. If there was, we would clean it off with the chlorhexidine then.
Oh, okay.
So I've got your new Tegaderm here. This is just going to go right across the top here. Make sure that tubing has no kinks or anything in it.
Okay.
Okay. And this little piece I'm putting on now is going to have my name and date so that the next nurse knows exactly who changed it and when it was changed.
Okay.
So, don't need to be sterile anymore. Just going to get this stuff out of the way. Take off my old gloves here. So we're going to do that blood draw now that I was telling you about, okay?
Okay.
Put some clean gloves on here. All right, first thing I'm going to do is check for patency. Making sure it's going to still flush properly, okay?
Okay.
Take this little tape off. I'm going to clean the hub for 15 seconds. And I'm just going to flush this and make sure that it's working properly. Unclamp it. I'm using positive pressure. And it's flowing great.
Oh, I'm glad.
Alright, we're just going to clean that again. We're going to do that blood draw now. And just to make sure that it's clean, I'm going to clean it again. And because I flushed that, we're going to draw out 5 cc's and just waste that. You know what that means?
Yeah, you just discard it, so it's not going to be my blood sample?
Nope, not this one.
Oh, okay.
Make sure I clamp that back off. I like to be clean, so we'll clean it again. And now I'm going to draw that blood to test your CBC, okay?
Oh, okay.
Unclamp. We just need about 5 cc's for that's all.
Okay.
Have my needle here to put into this tube. So that is full. Put that safety back on there. This goes in the sharps container. So I have this blood tube on it. I have your patient label on it. If you can just take a look at that, make sure it has Tinkerbell on there and your birth date.
Yeah, Tinkerbell, and that is my birthday.
And I'm also going to put my name and time that I drew it, and my and make sure that the date is correct on there as well. And I'll
Okay.
get that sent down to the lab. So since we drew your blood, we're going to change that cap as well. Anytime that blood gets drawn, we need to change that, okay?
Okay.
And I have my pre-flushed cap right here.
Okay. You guys sure do have to clean your hands a lot.
We do. It dries the heck out of them.
Oh, man.
All right. So I've got your, just open this alcohol wipe up, making sure it's clamped. I'm going to take this old cap off. Look for any blood. If there's any, just going to kind of clean it off with this alcohol wipe here. Okay. Have my new cap here that's already pre-flushed. Hook that on there. Unclamp using positive pressure again. I've also got 5 cc's of heparin here that we're going to put into your line. This is going to make sure that that line stays free of clots.
Oh, okay.
5 cc's, positive pressure again. There you go. Clamp that back off. And then I'm just going to tape this up for you so it's kind of out of your way.
Oh, okay, good.
Knock you off the board there. There you go. It's taped out of your way. And then I'm just going to clean up my mess here.
That didn't hurt at all.
No, it should not have hurt. Do you have any questions for me?
I don't think so.
Perfect. I'm just going to get this mess cleaned up and then go and document everything that I've done.
Okay,
Thank you, Mrs. Bell.
thanks.